Well, Ron, we have Dr. Katie Thomas here from Intermountain Medical Center to talk about stroke awareness. And I guess we need to hammer things down because the symptoms are different for everybody. They could be a little varied. And I like that you came up with Be Fast. It spells out Be Fast. And you start with, what is it? Balance.
Correct.
Okay,
so,
what about balance would you notice?
So anytime that someone suddenly had difficulty with their balance or difficulty walking or any kind of difficulty with coordination, that could imply that that person had had a stroke.
Okay, so keep an eye out for that. Also, the E is eyes?
Yes, so any sudden change in vision is also a potential symptom of a stroke.
Okay, blurriness or anything?
Blurry vision or lack of vision altogether.
Okay. And then face?
Face, so any asymmetry in the face. So if you suddenly notice that your face or someone else's face is weak on one side, or if somebody complains of numbness on one side of the face, that could indicate that that person had had a stroke.
Okay, and are we talking about all of these symptoms at once, or could it just be one of them?
No, so any one of them, and that's why we have this acronym, such that anything could identify a stroke.
Okay, the next one is arms, that's sudden weakness in arms or legs, and then speech.
Speech, so any difficulty speaking, any kind of incomprehensible speech, so somebody speaking gibberish, and that kind of also leads into confusion or disorientation that happens all of a sudden. So any kind of comprehension problems that happen suddenly could represent a stroke.
And then the last one is time.
Time, and time is, the reason we put time in there is because there are interventions that we can do within a very short period of time to reverse the symptoms of a stroke. And so the importance of stroke awareness is such that people recognize it and come to the hospital right away, because if they come in within the first few hours, we can sometimes give a medication that actually breaks up the clot that's usually causing the stroke
and can prevent
permanent damage and disability.
So don't be afraid, don't feel like you're going to make people will think you're silly. Call.
No, absolutely. If you have any concern at all, you should go to the hospital right away, because, like I said, we can do things. And sometimes people have very minor symptoms, and it turns out to be a big problem in the long run.
Okay, so make the phone call. Okay, thanks. Good advice. We'll take a break and be right back.